And Amanda, Dr. Wolf is the chairman here of the emergency department, and he's no stranger to cases like this. You've seen carbon monoxide cases through your years here at St. Francis. So I guess the first question for you, doctor, is when the paramedics got to that house, what typically would they react? How would they respond to something like this in the garage of a house like this?
Well, first of all, they would have to make sure that they're not being exposed. So usually patients are moved out of the danger area, and then the paramedics would respond just like they normally would to someone who was not breathing well or was unconscious, and then they would do the usual, if needed, CPR, intubate the patient, putting a breathing tube down into his lung if that was what was needed.
We were talking earlier about exposure. This is about how long you have been exposed to what is a toxic and lethal gas.
Correct. So one doesn't know what happens in terms of how long in these cases. So you basically treat the symptoms. If the patient's not breathing, you intubate and give them oxygen, and then transport them to the hospital, as was done. CPR, if needed, would be done as well. And then once it's discovered that it was carbon monoxide, then the decision is made about hyperbaric treatment.
Which is where Mr. Doulos stands now. He was airlifted by LifeStar to the hyperbaric chamber at Jacobi Hospital. What happens typically in a situation like this, and what does a hyperbaric chamber do?
Well, the hyperbaric chamber delivers oxygen much more efficiently, or allows the body to use the oxygen much more efficiently that's circulating. So, for instance, if you had carbon monoxide poisoning and just were breathing room air, it would take 4 hours to go to the half of that level where you started. If you use just plain oxygen, it's about 90 minutes, and if you use hyperbaric, you're forcing the oxygen onto the red blood cells in about 30 minutes.
It's 2.5 times the amount?
Well, the pressure that they are delivering the oxygen is at 2.5 times what normal pressure.
I guess it's from case to case, so you can never speculate, but a typical patient would be in a hyperbaric chamber for X amount of hours.
The time depends. It's varying times depending on what's happening with the patient, how stable the patient is. It's difficult to also keep an unstable patient in a hyperbaric chamber, because it's not like other personnel can help the nurses that are with the patient. So there are a lot of things that go into this. And you're basically delivering oxygen into the blood at a much higher saturation than it would be if there was no pressure being delivered.
And the lasting effects of exposure like this can range from X to what?
Well, I mean, the major thing is, in many of these cases, if you're unconscious, is brain damage. And so that's what one worries about. It's no different than if someone has a cardiac arrest and they're without circulating blood and oxygen to the brain until they sort of respond and regain their life signs. You don't really know what the end result will be.
It becomes a waiting game for now.
Again, I'm not involved in the treatment, but that's usually what happens. And most of the carbon monoxide poisoning that we see, patients are affected in terms of they're dizzy, they have headaches, they can lose consciousness. And in this case, it appears that he was unconscious, and and whether he needed CPR or not, none of those details I know.
Of course. We always appreciate your time and your insights and your expertise. On short notice, Dr. Wolf, we really appreciate it.
Thank you.
We're live here at St. Francis this evening. Jim Altman, Fox 61 News.